Hello, I'm Kathleen Dunn on the Ideas Network of Wisconsin Public Radio for this Wednesday, the 24th of August. It's not August. Believe me, it's not August. It's April. As you know, I'm a big dog lover, and I plan at some point to raise a therapy dog and take the dog to schools and reading groups and hospice. And I've been very moved lately by watching the TV reports from Newtown and from Boston and also from Waco, Texas, where that fertilizer plant exploded, to see how dogs have been of great comfort to so many human beings. And the time seemed appropriate for us to talk about comfort dogs, therapy dogs, how dogs have been able to help heal in the aftermath of violence that we wish that we had not had to live through. So we're going to be talking about comfort dogs and therapy dogs, and we have a therapy dog with us in our studios here in Milwaukee today. In just a moment, the president of the Lutheran Church Charities, headquartered in Addison, Illinois, will be joining us. They have been bringing dogs to Newtown, to Boston. No sooner did they get back from Boston than they had dogs leaving to go to Waco, Texas. And joining us in our studios in Milwaukee is Laura Hay. Laura has a very interesting background. She's one of the country's few animal-assisted therapists, and she is founder of a program here, Health Healers, which is a full-service dog and cat therapy organizations. She provides therapy dog training classes as well as professional development to educators, counselors, and therapists who wish to incorporate therapy animals into their practices. And as you well know, this is really growing. She's been a presenter at professional conferences for occupational therapy, traumatic brain injury, and Wisconsin Adult Day Services Association, and she attends workshops and seminars on dog behavior and cognition and dog training. She has brought a beautiful dog into the studio, a border collie, and I didn't know there were many border collies who did this, although I know they're extremely smart dogs. Jasper is with us, and Jasper, and I don't know if Laura's picture is on Facebook yet or not, but it will be. But for sure, Jasper's picture is on Facebook right now, so go to the Kathleen Dunn Show. We'll be welcoming phone calls. I know that you have incredible stories of how dogs have been of comfort, and we want to hear from you, and how they've been of service to the country as we experience horrendous violence. Our phone number is 800-486-8655. Our email is talk@WPR.org, and our Facebook page is The Kathleen Dunn Show. Laura Hay, thank you so much. I can't thank you enough. Thank you so much for being with us in our studio, and thank you for bringing Jasper here as well.
You're very welcome.
So when did you realize that dogs could do extraordinary healing?
Well, I've been an animal lover my whole life, but it was in 2000 that I became aware of animal-assisted therapy. And as an occupational therapist by background, I was always looking for meaningful and interesting ways to motivate and interest the patients that I worked with in their treatment sessions. So when I learned about animal-assisted therapy, it was a perfect match. I thought that bringing together my background in occupational therapy with the animal-assisted therapy degree, which I ultimately got, could help aid in the healing and recovery process of my patients. Mm. And we saw just that. Tremendous outcomes, great benefits, things that were happening without the therapy dog, things that weren't happening when the therapy dog was not, well, let me see. Things began to happen with the therapy dogs there as far as progress, motivation, interest, pain levels decreasing that had not existed prior. So.
And you have worked with people who have had some pretty significant injuries, haven't you?
Yes. Yes.
Tell me about the kinds of places you go with Jasper.
Well, Jasper's one of Jasper's main focuses is in a rehabilitation hospital. The first program that I started was at Sacred Heart Rehab Institute at Columbia St. Mary's Hospital. And in that program, I trained the therapy dogs, and I trained the handlers as well as the occupational, physical, and speech therapists so that they can effectively incorporate the therapy dog into treatment sessions. And as I said, the outcomes were just remarkable. So that program spread throughout the whole organization. And then it got to the point that I wanted to bring the benefits of therapy animals to as many people as possible. So I created Health Healers.
Mm-hmm. What is it about these animals? What is it about that human-dog connection that can allow some of the people you're working with to do things that maybe they never even thought they could do, or to make a connection that I'm sure is a pretty powerful connection?
It's very powerful, and we don't have all the answers yet. Some thought is that it goes back to our early relationship with dogs, domesticating dogs thousands of years ago. But there's actually things that occur in our bodies, chemically, hormonally, blood pressure, skin conduction responses, many things that happen with that contact with a therapy animal. And because of that, it ultimately impacts our behavior, our interest, our motivation, our socialization, like I said, pain levels, all of those things. So it can have a profound impact on people with a wide range of challenges and abilities.
So what you're doing now is training the people too, and the dogs? You're doing everything.
Yes, Health Healers is a full-service therapy dog and cat organization. So I do everything from training the therapy dogs and the handlers, who are most often the owners. And then I develop programs, provide consultation services for places wishing to incorporate therapy animals, and then train the professionals who want to incorporate the therapy animals into the practice.
You are doing incredible work, really, aren't you? You really are.
It's so rewarding. It's just unbelievably rewarding, because every time there's something incredible that's seen, that a teacher or a counselor or a handler comments on, that was achieved, that often wouldn't have been otherwise.
And tell me, you have Jasper here, who's a border collie, and I was talking about the fact that border collies, I know, are really smart, but they're herding dogs, and you see them usually in the field herding sheep. Are there certain kinds of dogs that you have found are more amenable to the important work that you're doing than others, or can you train almost any dog to do this work?
You can do some training. Most of it is temperament-based. You can train them for obedience and safety behaviors and things like that. But a lot is temperament-based, and I have just about every breed of animal, dog in my program, as well as 5 therapy cats. And much of it is about their social skills, their interest in interacting and maintaining that engagement with multiple strangers time and time again. So it's really work for them, but it's a job that they enjoy.
Where has Jasper been?
Jasper,
with you, I might add. It's the two of you.
Jasper has worked in after-school programs, summer camp programs, rehabilitation programs with therapists. He's worked in counseling programs, hospice.
And you do therapy cats, too. I'm not as aware of that.
Right. There are less than 200 registered therapy cats in the country, and there are 5 in the Health Healers organization. And the therapy cats aren't trained in the same way that dogs are, but they do have to go through much of the same testing. They have to go through a pretty extensive and stringent test to become therapy animals. And with the cat, because we don't look at obedience, following cues and commands necessarily, they have to have really incredible temperaments, be able to handle travel well. They have to be able to go to unfamiliar places and, again, be introduced to unfamiliar people.
Right.
And that's not typical for many cats.
Yeah, I'm sure. So what is the testing? Tell me about the program that you put the animals through.
The testing is actually follows the guidelines of the Pet Partners organization, which is a national organization that registers the therapy dogs and cats, and they do other domestic animals as well, and they're the only organization that does that. The testing involves looking at obedience, temperament, safety, social skills, and how the handler is able to help support the animal so that it's confident, comfortable, safe, and secure in all of those settings. They have to be able to tolerate unfamiliar handling, sudden unexpected noises,
I'm sure.
Things that might, show up or come about that aren't anticipated. So it looks at a lot of different things, and Pet Partners is really big at looking at how the handler and the animal work together.
Mm-hmm. And what about the people who are the handlers? Are they the owners of the animals, the cats and the dogs? And what kind of training do they go through? Do you have to teach them?
Right. They are usually the owners, although I have had a grandmother with her granddog, and a neighbor perhaps might be interested in using a neighbor dog that they have a strong relationship with. I had an inquiry about that one time. Someone did not have a dog of their own, but had a very strong relationship with their neighbor dog. But again, the testing and training they go through would assure that was a good relationship for this kind of work. But the training often involves therapy dog classes, which I teach to help prepare for the pet partners evaluation. And again, those are standards that are set by the national organization. The evaluation is conducted by a licensed evaluator. So my classes help therapy dogs and their handlers prepare for that test. And then one of the things that's unique about Health Healers is that placement is made based on having a good match between the therapy dog team, the handler and the dog, and the facility and the population that's served at that facility, because not every therapy dog has strengths in every area. Mm-hmm. So that match is very important. And then once a match is placed, Health Healers provides very intensive on-site training, again, to the handler, to the dog, and to the professionals that are involved.
Ooh, aren't you an angel, really? I mean, you must just be so welcome in the places that you go to be. When people talk about job satisfaction, yours must be way up there. I mean, I know it must be significant work, but
it's huge, though, as far as the blessings. I mean, and the animals and the handlers I work with are absolutely incredible. They just are so devoted and so caring. It's hugely rewarding to be in that circle.
Oh, I'm sure. Mm-hmm. We're also going to meet Tim Hetzner, who is joining us by phone from Texas. My understanding is no sooner did Comfort Dogs get back from Boston, where they were visiting people in Boston and also people who had been wounded significantly in the horrible bombings last week. Tim is now in Waco, Texas, where they have taken dogs because of the terrible fertilizer explosion that took place and the number of people who were injured and killed in that. And so Comfort Dogs have gone there. They left out of Milwaukee fairly recently. Tim is president of Lutheran Church Charities, which is headquartered in Addison, Illinois, and they have a program that is very, very active nationally that works with Comfort Dogs and probably trains them as well. So we wanted to hear from Tim. You've probably seen some of their dogs on various news reports from Boston and also from Newtown. Tim, thank you so much for being with us.
Great to be with you. Sorry I was a few minutes late.
That's okay. I know that you're very busy. Tell me a little bit about the Lutheran Church Charities and how I know you're very involved in sending Comfort Dogs all over the country. How did all of this start?
Well, Lutheran Church Charities, one of the things that we do is disaster response. So we send volunteers in on disasters on the front end and throughout to help people, depending on what the disaster is, whether it's flooding, tornadoes, hurricanes, whatever it may be, throughout the United States. And we saw, as we were doing that over the years, we saw the value of animals and people. In fact, with Katrina, we were asked to, when they were rescuing people from their homes, they were not rescuing people and their animals. And so we were asked to do search and rescue with people and their animals. And so saw the power of people when they, would put their life at risk rather than be separated with their pet.
Yes.
So in August of 2008, we started the Canine Comfort Dog Ministry, where we place dogs in churches and schools to serve their church and school and community in a variety of ways, nursing homes, hospitals, funerals, whatever the needs are in that community. And then when there is a crisis or a disaster that occurs, we deploy dogs out that have been placed. So in Newtown, for example, the shooting took place on December 14th. We had 10 dogs and 15 handlers out on the 15th, and have had a dog in Newtown ever since then.
Have you?
Still do in Sandy Hook School, and we'll probably have a dog out there at least through May. In Boston, we had dogs out there, and still have a dog out there right now, serving in that area. We're working through First Lutheran Church, which is a couple blocks away from where the bombings took place. And now I flew back into Chicago and then deployed another group of dogs out here in West Texas, where we're at now. In fact, I was with the volunteer fire department here in West, and then the other firemen that have come in from all over the U.S. to be here because of the funerals of the volunteer firemen that were killed.
I should formally introduce you to Laura Hay, who's in our studios in Milwaukee, and she's one of the country's few animal-assisted therapists. She's done extraordinary work, and she trains the dogs and works with the healers and trains the rehabilitation staffs as well. And she has brought Jasper, a border collie, into our studio. And yeah,
I love border collies.
Yeah. What kinds of dogs do you use? Do you use?
We use all golden retrievers. And that the other dogs are wonderful dogs, but what we have found with golden retrievers, they're good inside and outside, which is the type of work that we do. They're lovers. I mean, they just love people. And we have our own breeders, and we have our own trainers, and we start training them at between 5 and 8 weeks, depending on the dog, and spend 8 months to a year more that dog in training. All of our dogs are trained to and need to work with multiple handlers, and then we train the handlers and we train the caregivers for the dogs to use them, and that's an ongoing training that we use in helping the dogs in the situations in which they work. Our dogs also need to be able to work with all age groups, from little children all the way up through elderly and disabled, and they also need to know how to ride escalators and elevators and fly and all that stuff, because they do travel.
They travel a lot. They have to like to travel, don't they?
Well, they've got quite a few miles on there.
I bet they do. Yeah. You used probably a key phrase here, and let me have you respond to that, too, that these dogs are lovers. And I think that may be the key to all of it, that people are realizing that there is a love that the animal has and that the people immediately have for this animal, too, that emotion, that's just wonderful, isn't it?
And it is it's an unconditional love.
Yes.
The dogs don't pass judgment. They don't care how people look or how people move or what people say. Right. They're there to connect with them regardless.
They're good listeners.
Yes.
And they're confidential and don't take notes. So and we find all the time, and no matter what situation, with many times all ages, they will talk to a dog before they'll talk to a person. And so they will share their story with the dog. Out in Newtown, there was a boy that was in the classroom. He didn't talk to anybody. And then he points at one of our dogs and goes over to it. He says, "I'll talk to the dog."
Oh.
And he goes down and shares with the dog what took place, which is an important part of the healing process, as I'm sure you would say there, too, of being able to talk about what you've gone through helps a person process and heal with the crisis or whatever the event was that caused that. And because dogs don't talk back. The advice our dogs give humans is to bark less.
Let's go to phone calls. Our phone lines are absolutely flooded here. Laura Hay is joining us in our studios, and very importantly, Jasper is in the studio as well. Go to our Facebook page. I think Rhonda has put a picture up already, and there will be more, I can assure you. Jasper is a comfort therapy dog. Laura is one of the country's few animal-assisted therapists in the country, and she is founder of Health Healers, which is by every stretch of the imagination, a full-service dog and cat therapy organization. Tim Hetzner is president of Lutheran Church Charities. They are headquartered in Addison, Illinois, but Tim is currently in Waco, Texas, where there has been a need for canine comfort dogs there. They still, as you heard him say, have a dog in Newtown, and they have been in Boston as well. Our phone number is 800-486-8655, 800-486-8655. Our email is talk@WPR.org, and our Facebook page is The Kathleen Dunn Show. And we start our calls with Myrna in Westport. Hi, Myrna.
Hi, good morning. I wanted to say a couple of things. First, I'm a mental health professional and have been for a long time. I used to run a pet loss support group in the Madison area back in the 90s. But back in the 80s, actually, when I worked in the VA system, I wanted to get a program going, especially for Vietnam veterans, that would help facilitate some of their trauma through a therapy animal. I've been aware of the healing power of animals for a very long time, but I guess I was a little ahead of the time there. There were just a lot of concerns about zoonosis and, animals passing things on to people or liability issues. And I also felt that this was a very important service to be available to people who are in hospitals and are recovering from some kind of life-threatening episode.
Yes.
So I'm really glad that there are organizations now that are doing this. I'm sorry that I wasn't able to participate, but I'm...
Oh, Myrna, it's never too late. I think you should do it right now, as a matter of fact, and get a hold of Laura right here in this area, and you can do this. Why is the time, why have we all of a sudden realized this? Laura, let's start with you, and Tim, I'm interested in your response, that dogs can do this, and cats, that this is a very good thing.
Right. Well, dogs have been used in the healing process for many, many years, decades. But it's only been recently that there's been more scientific evidence that supports the benefits that therapy animals can bring, especially to situations such as she described in more goal-directed interventions where there is a purpose and intention for emotional well-being or for physical recovery and things like that. And the science is really starting to show not only that it works, but why it works. So I think that's a big part of it.
Mm-hmm. And how do you answer that, Tim?
Well, I agree. And I think, the history of dogs and how they've been used, the dog man's best friend, not just a cliche. And I think the health profession and others are waking up to that value. That dogs really have a sixth sense of empathy to be able to sense when somebody is hurting. Mm-hmm. We see this all the time with the dogs when we're out, that they will actually target and see somebody and nudge the handler to approach that person if they want to pet the dog. And boy, they're right on target every time. I wish humans had that same full capability.
Yes, I wish they did as well. Yeah. Thanks, Myrna, very much for the call. Are there, I would imagine, after seeing all of these dogs do such amazing work, that a lot of people would like to do this. Is there proper training available? Are there enough dogs available for the need?
Well, I think there can always be more programs to serve more people and more dogs and handlers to serve that need. There is training available through health healers for people that are interested in getting involved. I mentioned the therapy dog classes. I also offer free screenings where I assess a dog's potential and readiness for therapy work.
You do?
Therapy animal work is very exclusive. It goes beyond being a friendly animal. As I said, the animal has to be able to tolerate wide range of situations and experiences comfortably and confidently. So.
Tim, what about you? How do you find the people, and do you find that there's even more of a need? You're doing things on a really large level here.
Well, we place dogs, so the dog is actually then the property of LCC in the church or the school in which we place it. We screen our handlers, and not all people are good handlers, because it's not just the handling of a dog, it's also being able to listen to people. Our handlers are not therapists, and we don't, although some are, but we don't bill ourselves as that.
Right.
In fact, in many cases, we are our dogs are tools for other professionals to do their skill, their work, and so we bring in that tool, like in Newtown with the counselors and teachers that are out there. They use our dogs as they serve their children and families. So, but there has to be high standards with the dog, and not every dog can do that. We have dogs that, I don't want to say flunk out. They're good dogs, but
sure,
but they just cannot deal necessarily with, because it's stressful for a dog. That's why you have to give them breaks. They take on the emotions of the people that are petting them. And so you have to, like with a therapist will tell you too, if they see too many people in a row, they need a break.
Yeah.
And dogs are the same way, and you have to have somebody that's very sensitive to that, knows the dog, and knows when to have the dog back away and remove it from people for a while, particularly in situations that we work in disaster response and other things. That becomes very important, because we could have people in disaster response situations petting the dog or being with the dog 12 hours straight, and you can't do that to the dog. It's just it's not right, and it's they need a break.
Yeah. More phone calls in a moment and emails. We're really getting flooded with everything. We're talking about comfort dogs, therapy dogs. We've been through so much violence and emergencies and tragedies in this country that a lot of people have been struck by the images of dogs in hospitals and dogs who are helping people who need rehabilitation, the incredible bond that can take place, and the fact that we've got unconditional love here, and that it in many ways is a very, very good thing. Laura Hay is one of the country's few animal-assisted therapists. She's the founder of Health Healers, which is a full-service dog and cat therapy organization. She works with providing the therapy dog training classes. She also works with the people in the professional area to train them to have dogs come into their facility. She has brought a beautiful dog here, Jasper, and there's a picture of Jasper on our Facebook page as well. Tim Hetzner is president of Lutheran Church Charities. They are headquartered in Addison, Illinois. They have sent dogs to Newtown. There still is a dog there, to Boston, to New Orleans, and they are now in Waco, Texas, and they are working with its Lutheran Church Charities, the Canine Comfort Dogs program. Here's how you reach us: 800-486-8655, 800-486-8655. Email talk@WPR.org. This is the Ideas Network of Wisconsin Public Radio. And we go back to phone calls. Liz in Madison is next. Hi, Liz.
Hi, good morning, everybody. I just wanted to say, Kathleen, I think you'd make a great therapy dog handler, and like you told the woman from Westport, it's never too late to get started.
I know.
I belong to a group called Dogs on Call, which is a local animal-assisted therapy group here in the Madison area in south and southeastern Wisconsin. And we have many hospitals, nursing homes, and schools and libraries that we go into. And we have all sorts of dogs, big ones and little ones. We now have 2 cats, and we also have some miniature horses that do some visiting.
Horses? Oh.
But we have a huge university program, and that's just what I wanted to talk about just for a second or two, in that we take our dogs in to visit the students at the university during midterms and finals to help de-stress, relieve some anxiety, and just help students who are away from home for the first time and are feeling lonely. And it is a huge program. It's grown over the 4 years that we've had it available at the UW, and it is so much fun, and the dogs love it, and the students respond so highly. In fact, we had a student who said that after she pet a dog last year, she got an A on her philosophy test.
Oh, right.
So,
of course.
it really, really works, yes. But a question I had for Tim is, one of the things that we do for our dogs is we're advocates for them.
Yes.
We work as a team, but we're also their advocates to watch how they're doing. And as soon as we notice any stress signals in our dogs, we're up and moving around with them, either outside, or if it's a point where the dog cannot recover, we leave because we can't expose our dogs to becoming too stressed. How does that work with you, with your dogs, and what sorts of stress signals do you see in your dogs that it's time to walk away for a while?
Well, we certainly, I agree with you. That's very important to know those stress signals, and it's getting to know the dog. The handlers have to get to know the dog and to know when the dog just, when people come up to it and it kind of gets a little shy or skittish, or you just look at time also and the number of people that have petted the dog. That, some dogs have a limit of an hour and a half maybe, but others can go a little bit longer. But then we always then err on the safe side. You don't wait until they get too stressed. You err on the safe side and you get them up, you get them out, you take the vests off, you let them run a while, play ball with them, and then, bring them back in. So I absolutely agree. It's knowing the stress. And we have professional trainers and veterinarians and others that work with us and teach us as we go through the training with the dogs of what those stress signs are.
Laura, I'd like for you to answer that too.
Sure. I agree. Thank you for bringing up that point. I think that it is so critical to be aware of the potential for dog stress in these situations. I've attended over 100 hours of workshops and seminars on dog behavior and dog training, and one of the things that I'm always looking for more information on is how animals communicate that stress to us, because they are working. And again, as she mentioned, as the caller mentioned, it's very important that the handler be an advocate for that animal and be aware of that. So through my education, I help educate the handlers as well.
There are some people who don't like dogs and who don't like cats. How do you deal with that in a hospital setting, in a rehabilitation setting? How do you know when it's okay to work with somebody or when they may be frightened?
Well, it's always optional. But if people have a history of having relationships with animals, they're usually very willing participants. The handlers are trained to look very, very carefully at body language of people who they might be approaching in the hallways and things like that. And we never approach without a very direct and explicit invitation. So it's...
Right. You need the invitation.
Same thing. We have what we call dog etiquette. So we never position. Many times we'll sit with the animal and in a spot, but we never position ourselves where somebody has to walk by at the dog because of allergies and fears that people have.
Right.
So it's off to the side, and I agree too. You look at how people are reacting. They can tell if they see a dog and they have this fear look on their face. We don't go up to them.
Right.
In fact, we don't. Our dogs are trained not to approach people. Actually, it's people. If they want to come over and
who come to the dog.
We're out.
Right.
Most cases. Yep. Right.
Thanks, Liz, very much for your call. Christy in Madison. Hi. Christy, are you there?
Oh, yes, I am.
Hi, go right ahead.
Animals have always played a really big part in my life. Up with dogs, and I've had cats, and I had a greyhound who he really preferred people rather than other dogs. And right now, my cats are just such a comfort to me. As you said before, they're non-judgmental, and I have a lot of anxiety problems, and they help calm me down, like sitting in my lap, and the purring is just a really comforting feeling. And as I said before to the operator, when when I have to just go to bed and put the covers over my head, they understand that, and they lay up close next to me, and my socialization with them is, really good. With people, not really good, but.
Thank you, Christy, for the call. Laura?
Thank you. Yes, animals can provide that cushion, that safety zone too around one's discomfort or anxieties, whether it's towards other people or being in certain situations. Excuse me.
Yeah.
So they can offer a lot of tactile support and comfort that way.
Yeah. Tell me, I know that your organization has, alas, had to respond to too many tragedies and emergencies. What is the process, Tim? I know you're in Waco right now. Tell me how you happened to, were you invited to come there? How you happened to go to Boston? How you know to respond to these national events?
Yeah. We only go in where we're invited.
Uh-huh.
And generally because we're a Lutheran, or we're a recognized service organization, the Lutheran Church Missouri Synod, so it's many times it's one of our Lutheran social agencies or one of our Lutheran churches that is in the area of a disaster that invites us in then with the dog. So we don't just show up. It's always by invitation.
Mm-hmm. And Laura, how about you? When you go to a variety of places as well, do they know that you exist, or how does it happen?
Often I do get invitations. Sometimes I make the initial contact to see if we can provide services for healthcare or educational or community organizations in the area. Mm-hmm.
Here's a Facebook post from Rachel. I saw a therapy dog on TV several years ago trained to work with children who were struggling to learn to read. The children were often too embarrassed to read in front of others, but they would read to a dog alone in a reading room. The dog was trained to paw at the book if the child stopped reading, which was so sweet to see. It's a great story, isn't it?
It is a great story. And those programs also are growing. We have local programs here through the Wisconsin Humane Society that therapy dogs and a therapy cat, Dexter, are involved in. And with reluctant readers, yes, it does increase their confidence. There's less stuttering, better retention of material, all kinds of benefits to having children reading to animals.
Yeah. Let's go next to... Oh, thanks, Christy, for the call. Let's go to Trudy in Milwaukee. Hi, Trudy.
Hi. Thank you for taking my call. What a wonderful show. Listen, we have owned many, many dogs over the years, and now cats. And they can read you like a book. These have always become our children. And what I've heard before, I would just be repeating what people who've already called in said. But two things I want to add, quick things. There's in the nursing home, there was a book written by a Dr. David Sosa, M.D., who took care only of elderly in a nursing home, and a lot of them were terminal, were going to be dying, and they discovered there was this cute little cat named Oscar that began just being allowed in the hospital and letting people pet them, and they discovered, it's just amazing that this Oscar cat would walk in, have rooms be visited all over the hospital, and Oscar could tell when someone was close to death, very close to death. In fact, Oscar would lie on the bed, and then the doctors and nurses would know, that's not long for that patient, and that's a very moving book. And just the other one, you know how when you go to this other book, when you go to the supermarket and you see all these tiny little things at the cash register, this was an old book. I don't know, The Healing Power of Pets.
That book rings a bell with me, too. Yeah. Thank you very much, Trudy, for the call. We appreciate hearing from you. What kind of work are you doing in Texas right now, Tim?
Well, we have been in the schools. You know, one of the schools here got totally destroyed, and so they moved children into another school in West, and into another rival school actually that is in another town close by. So we have been in those schools, working with the teachers and the counseling staff there. And particularly with we've been in all the classrooms. We're working specifically then now with students that have lost somebody with the explosion, or there are still 60 people missing, and so they're related to that or lost their homes. So, and some of them were just so struck that they were not able to talk, and this one boy in particular, was not able to talk. And with the second visit with the comfort dog and the counselor that was working with the student, he started talking. So it's rewarding in that way. We're with families, first responders, which is where we were just a few minutes ago, with first responders and firemen as they prepare for funerals this week and next week of them. But the support of people from outside of the area coming in has just been marvelous in that aspect of helping families. So we're going around to all different type of locations, nursing homes, because nursing home and many of the elderly in the town were displaced and incorporated in some of the surrounding nursing homes. So we're going in with the dogs there to spend time with those folks who have, for all practical purposes, lost everything and are now in a nursing home because they needed a place to stay. So it's a variety of emotions and things, and now the town, as it goes through what will be a long week or two of funerals, providing that comfort and aid to them.
Yeah.
Oh, wonderful.
Yeah, open the doors and come on in. People are happy to see you. What about the human beings? We put a lot of emphasis on the dogs here, and they just naturally do what they need to do if they're in this line of work. But what about the human beings? How do you train them to be sensitive? Do they take completely a backseat role, or do they need to be engaged in the process of rehabilitation as well in terms of handling tragedies? How do you deal with that, Laura?
Well, in our situations, yes, the handlers have to be very, very active. They are considered part of a team. They and their therapy animal work together, so they get extensive training to, again, prepare for the registration test, the therapy dog team test, but also on site. So in each site, each program is very specific, whether we're working with at-risk adolescents who are working on behavior management and social skills, or working in a rehabilitation setting with occupational, physical, and speech therapists. Each setting and each program, even in a hospital, for example, can have such variables. So the handlers need extensive training. I believe that's what really makes these programs so exceptional. Mm-hmm. They do get a great deal of training, so they know exactly what their role is. They and the dogs have all the information they need and all the skills they need to really be a strong component of that therapeutic team, that therapeutic process.
Yeah, that's so important. Mm-hmm. And what about for the people who accompany your dogs, Tim?
Well, they're trained in disaster response and the emotions that people go through in a disaster. But again, our handlers are not, and we don't certainly, that's why our dogs are not called therapy dogs. They're called comfort dogs. So yeah, and we make that distinction, and we're very supportive of therapy dogs and therapists who use dogs with that. That's an important part of the process. There's no doubt about that. But our dogs are there to, I think, sometimes is that initial bridge, sometimes with people out and in crisis situations to bring assistance. Our handlers, one of the big parts of training handlers is to be quiet, let people talk, and give people time to talk, and not to inject the things into a conversation that shouldn't, but how to encourage people to share. And because we're a Christian ministry also, if the need is appropriate and the situation is appropriate, we're there also to provide spiritual care and counsel for people and to pray with people. Because of the nature, we're a Christian ministry.
Go ahead. More phone calls in a moment. 800-486-8655. Comfort dogs, therapy dogs, and cats this hour of the program. We've seen them at work a lot lately, and we thought it would be interesting to spend an hour figuring out how this is done and maybe even inspiring a few of you to join this movement, those of you who are attracted as I am to it. Joining us in our studios in Milwaukee, Laura Hay. And Laura is the founder of Health Healers, which is a full-service dog and cat therapy organization. And she has brought Jasper with her as well. Jasper is sleeping right now on the floor. Needs a little break. And Tim Hetzner is also with us. Tim is president of Lutheran Church Charities. They're headquartered in Illinois. They have been with their comfort dogs, canine comfort dogs, in all kinds of places. In New Orleans during the horrendous floods. They are in Texas today. There is a dog still at Sandy Hook Elementary School, and they have brought dogs to Boston, to the hospitals and to the streets of Boston. More phone calls in a moment. This is the Ideas Network of Wisconsin Public Radio. And we continue our conversation and welcome phone calls. The number is 800-486-8655, 800-486-8655, and our email is talk@wpr.org. So let us welcome more phone calls. Leah is in Franksville. Hi, Leah.
Hi, I'm Leah, and we run Stepping Stone Farms, which offers equine-assisted psychotherapy.
Oh, great.
We use horses, the very much similar ways that your guests are talking about. We have cats and dogs as well, including a Border Collie, Sparky, who we call our greeter dog. So we just use a larger animal in offering people therapy that have had trauma. We work with returning veterans, and we work with a lot of children out of the foster care system.
Well, now, what is the name again, Leah?
Stepping Stone Farms. We're just about 20 minutes south of Milwaukee.
Stepping Stones Farm, 20 minutes south of Milwaukee. And you know about this, you can tell.
I have heard of Stepping Stones, and one of the workshops I went to several years ago before I was beginning my programming, and just after I got my degree in animal-assisted therapy, was a workshop on equine-assisted therapy.
Oh.
And yes, there are very, very similar applications.
Yeah. Mm-hmm. Wonderful. Well, we'll have to have you come and visit us sometime. That would be nice, Leah.
I would love to do that.
All right. Please, we'll do that. Thank you.
Thank you.
Debbie in Whitewater is next. Hi, Debbie.
Good morning. My dog and I have been a registered pet partner team for about 3 years.
Oh, great.
We are affiliated and we're trained by the group Dogs on Call, which a previous caller mentioned. And I just wanted to kind of reiterate something that had already been brought up, and that is the level of commitment that is required to do this. I don't want to discourage anybody because certainly we need more of these teams. But in addition to the extensive training that an organization like Pet Partners requires, oftentimes if you then go to do some work with a local hospital or hospice, for example, you need to go through their training as well. In addition, there's a lot of physical requirements, I guess, in the sense that your dog has to be, you and your dog have to be reevaluated every 2 years, and the dog or cat or whatever animal it is that you're taking in has to be bathed within 24 hours prior to the visit. The other thing is that the dog has to be absolutely what I call bulletproof. I have 5 dogs at home, but there's only one that I do this work with because I know that no matter how roughly, I work with a lot of dementia patients, and no matter how roughly someone may try to, grab him, he is not going to respond in an aggressive way whatsoever. And although we are advocates for our dogs, sometimes these things happen just so quickly that the dog really has to be bulletproof.
Yeah, I'm sure that's true. There are certain dogs who can do this. Other dogs,
absolutely,
who can't. No doubt
they
about
have to
that.
be very exceptional.
Yeah.
I think.
And what about people? Are you looking for people to work with your therapy work with canine comfort dogs, Tim?
Well, first of all, we're not doing therapy work, but we're always looking for handlers to work with where we're placing dogs to be trained and to go out. And we're also looking for trainers with our dogs. We have our own training program that will the 8 months to a year in that process of training a dog from a puppy through before it's placed.
Yeah. All right. Thank you very much for your call, Debbie. I feel like I don't want to say goodbye to everybody, but I'm afraid that we're going to have to. How long will you be in Texas? Do you know at this point, Tim?
Well, I will be in Texas at least through Friday, and we're still assessing the situation if we're going to bring in other teams into Texas into next week and the following week. So that I should know that in a day or two.
Thank you so much. All the best to what you do, and thank you for what you're doing. It's obvious that it makes such a huge difference. It's just a good thing.
Okay.
Yes,
thank you, and God bless.
Thank you, Tim. And Laura, will put information about your program on our Facebook page as well. And
thank you.
And carry on. You're just doing terrific work, and you're doing the whole thing. You're doing all of it. Thank you.
Well, it's the dogs and the cats that really do the work.
Yeah, I understand, but they need you too, because you can talk. You have opposable thumbs.
Right, exactly.
And I'm going to go spend some more time with Jasper
Kathleen.
now. Thank you so much, Laura Hay. Her organization is Health Healers, a full-service dog and cat therapy organization. Thanks to Veronica Rickert for producing this program, and thanks to Katie Matson and to Rhonda Fanning. Go to our Facebook page to see Jasper and Laura as well. It's the Kathleen Dunn Show. We'll be with you tomorrow.